Well, hello, everybody, and welcome to this week's episode of Perspective Matters, This Week in Behavioral Healthcare. My name is Glenn Hadley. I'm the Director of Operations for Southworth Associates, and I'll be your host today. Just for those of you guys that are new to the show, I want to give you an idea of kind of what we do here. And so the goal of the show is to address topics in behavioral healthcare ranging from clinical, operational, marketing, business development, and public policy. And the goal for the show is to be a resource for our field and a platform to discuss new and emerging trends, but also to really bring mentors and people that have been in this industry doing good work for a while out to the masses. And that's kind of what we do here. And so we're really excited to join you guys today. I do want to take a moment and thank our sponsors, because without our sponsors, we don't have a show. And so I want to thank Southworth Associates and Dreamscape Marketing for giving us the platform and the time to put this together and to bring this show every week on Wednesdays. So if you guys have any, when it comes to virtual events needs, Southworth Associates and Dreamscape Marketing have put together a tremendous platform for all of your virtual events, trade shows, or meetings. So please reach out to them, and also thank them for allowing us to do the show. Southworth Associates is also experts in interventions on the front end and then monitoring on the back end. And Dreamscape Marketing does really, they're the experts in the marketing area of behavioral healthcare and substance use treatment. So reach out to those guys for sure. So we got that out of the way. I want to go ahead and welcome our guest here today. So our guest is Joanna Conti. She's the founder of Vista Research Group and Conquer Addiction. She's a scientist, a serial entrepreneur, a reformed politician. We got to talk about that for a little bit too. And she spent the last 5 years focused on helping addiction treatment centers measure and improve their during treatment and post-treatment outcomes. And so, Joanna, welcome to the show. Thank you for being here.
Well, thank you. It is such a pleasure to be here, Glenn. Thanks for inviting me.
Excellent. So let me ask you, I usually ask everybody that comes on the show, like, how did you get into this field? And I know for you, we've talked, and I know it's a very personal experience. So go ahead. Do you mind sharing that with the audience?
Oh, of course not. So about 12 years ago, it became pretty apparent to my husband and I that one of our daughters had a very serious alcohol addiction. And unfortunately, that started a many-year process where we kept finding ourselves in the ER with a daughter who, would have a blood alcohol level, well over the rates that, other people had died from. And sometimes she was airlifted there. I mean, this was, we were through the ringer. And, we were in this situation where, we knew we had to find treatment for her immediately, and we had no idea where to turn because, there's such a stigma, unfortunately, still around addiction that, you might have your next door neighbor might have had a child or a husband or something that struggled with it, but you wouldn't have talked about it. And so suddenly you're confronted with a life and death situation, and you have no idea where to go. And so, what I would do is each time this happened, I was forced to just pick what treatment centers to contact on the basis of just sheer chance. So, in one case, it was 6 months earlier, somebody had mentioned at a picnic, hey, I heard good things about this treatment center, and so I would call them up, and, the admissions counselors are always so nice. They're so caring and wonderful. They do their job really well. And I would say, and what's your success rate? And they'd say, trust me, we're one of the best, and I, this was back in the days when insurance didn't pay anything. And so, we were shelling out, tens of thousands of dollars every time, and our child's life was at risk. And basically it was a crapshoot. And the good news is we were always lucky, and we always found excellent treatment every single time we lucked into really excellent treatment. And as a result, my daughter recently celebrated 7 years of sobriety. And yes, she has completely turned her life around. She's got a wonderful job. She's about to give birth to her second child. She's a fantastic mom. She's married. They own a house. I mean, if you'd asked me even 8 years ago if this was, likely in the future, I mean, I was just terrified that the phone was going to ring and somebody was going to tell me that my daughter had just died. So, I mean, we have been incredibly blessed. And when the worst was behind me, I thought, there's got to be a way for the parents to come that are coming behind us to find treatment centers with the best outcomes. I'm sorry, I've got a very talkative cat who heard me talking and decided, you know what, it is time for me to come visit.
I love it. It's one of the things that one of the side benefits of this whole deal is that we get to meet everybody's pets. We've met kids. It's been fantastic. I think I love it personally. I think we should do a whole kind of an outtake show one day of like everybody's pets coming in and being a part of the deal. So not a problem. And
You're gonna see a fluffy black cat, I think. We don't have any grandkids here at the moment, so fortunately we won't have those interruptions, but they're a little harder to deal with. But so anyway, when I started to think, there's got to be a better way. I mean, good heavens, this was 2015. Like why? I can look up on the website. I can say, I'm choosing between these doctors for knee surgery. Which one has the better success rate? Which one, which hospitals have more deaths? I mean, you can look these up, and here I was relying on a picnic comment 6 months earlier. I should check out this place, right? I mean, it was just absurd to me. So back in 2015, I decided to create a website called Conquer Addiction, where families looking for treatment could enter their criteria. It needs to be located here. It needs to, it needs to, serve adolescents. It needs to take Blue Cross, whatever. And you would get a list of treatment centers that met your criteria, and you could see which ones had the best proven outcomes. So I went ahead, I was running a marketing agency at the time, and just as a side project, as a labor of love, I created this website and was able to find 5 treatment centers in the entire US who were tracking their outcomes and would share the results with us. And I was just flabbergasted. I'm like, you've got to be kidding me. Why aren't people measuring how effective their treatment is? And so I decided at that point, I really couldn't start to promote a website that recommended Karen and the 4 foundation recovery centers. And instead, I decided to go to one of the addiction treatment conferences. And I just went, not sure anything would come out of it. And I started talking with treatment center owners, and I said, I don't get it. Why aren't you tracking your outcomes? And enough of them said, we want to, it's in next year's strategic plan. We don't have a clue how to do it. That I thought, there's a business opportunity here. And I have, as I mentioned, I have an incredibly diverse background. I'm a chemical engineer by training. I have a master's in international business. I've helped launch businesses in Argentina and Japan. I've started multiple nonprofits. I've helped orphans and street children in Africa and Asia. And as I said, I ran for Congress and county executive. And, but one of the many things I have done is I taught myself how to program, and I spent 5 years running a software company. So I could look at what was involved in measuring post-treatment outcomes, and I could say, hey, this isn't rocket science. We can figure out how to do this cost effectively. So I started Vista Research Group in the late in 2015 to do that, to provide cost-effective post-treatment outcomes research to addiction treatment centers. And again, it was a side project. And shortly after I started it, I came across all of the academic research that shows that if you monitor patients while they're in treatment and immediately report those results to their clinicians in a very easy to understand fashion so that the clinicians can see exactly how the patients are feeling, that patients get better faster. And I thought, this is an obvious thing to add to what we're providing to our clients. So we have been providing, as Vista Research Group, both types of research to our clients since March of 2016. And we've been growing rapidly through that time. We've added all sorts of additional features. We've added an insight behavioral group. We've added a special detox program. Recently, we've added research specifically for MAT programs with a harm reduction focus. And so we've been continuing to add more and more features and make it easier and easier for our clients. And when COVID hit, frankly, people weren't interested in talking about additional, expenses for doing more research. And I thought, okay, well, this is not going to be a time to really focus on sales for Vista. And what I had realized was in that intervening 5 years, we had now reached a critical mass of treatment centers across the country who were measuring their post-treatment outcomes, whether through Vista or, there's other outcomes companies. Some people were doing it themselves. But finally, 5 years later, there was a critical mass of treatment centers who were doing this. And now, while it's still the very beginning days, we could now help people searching for treatment to find treatment centers with proven outcomes.
Well,
and
let
so
me ask you real quick in that, because one of the things that I've seen over the years is that actually doing outcomes and recording them and really spending time and effort into it, that is relatively new. Like it really is, because I know that there are a number of people that have been focusing on it for years. I mean, but as far as being a priority in the industry, that is relatively new. What's been the onus for that? Like, how come we're starting to see more and more people focus on it now? Like, let's say in the last 3 years than in the 20 or 30 years leading up to that?
Well, I think there's a number of different factors. I mean, the industry is finally growing up, it's joining the rest of healthcare. I mean, our focus has been, we all know addiction is a chronic disease. How have we made such progress in treating cancer over the last multiple decades? We've had different treatments that we've tried. We've seen, we've measured which ones are effective. We've done more of the effective ones. We've learned from the ones that didn't work so well. We kept, in other areas of healthcare, we keep experimenting, measuring, and using those results to improve. But addiction treatment has been kind of this oddball in that, people have tended to believe, well, this is what really worked for me or for, other people I know. And so, this is the right thing to do. And there's no way to measure it, which is, of course, nonsense. Of course, there's a way to measure whether people are succeeding with treatment or not. And so we've seen a lot of things like, the move to value-based reimbursements and stuff where, the payers are saying, hey, we're spending a lot of money for addiction treatment. We want to see that you're providing good value to us. And so the payers are asking for it. The Joint Commission also looked at exactly the same data, I think, that I came across, 5 years ago, that showed that the process of monitoring patients while they're in treatment, patient-reported monitoring, and reporting the results to the patients helps patients get better faster. And 2/3 of the clinical trials that they've looked at, and all 3 of the addiction treatment studies that had studied the importance of progress monitoring, it made a significant difference in how quickly patients recovered during treatment. And so that when the Joint Commission created a requirement that all accredited behavioral healthcare organizations start tracking their patient-reported outcomes during treatment, then that brought during treatment monitoring into the into the foreground of most practitioners who are really trying to use state-of-the-art tools and provide the best possible treatment. Because the wonderful news is there's a tremendous number of really excellent treatment centers out there. Yeah, there's a few bad apples, but there's a tremendous number of really caring programs that are trying to do everything they can to help desperately ill people. And we need to recognize all those organizations that are doing wonderful work.
Right,
So
because just like in your experience, like that treatment works. I come across people like treatment does work, and I think one of the areas that we've been challenged in is that we're trying to quantify certain things like a therapeutic alliance between the provider and the patient, right? Because that's where we see the healing take place. And so trying to explain that and quantify that's been a challenge, and so, but we know that it works. What, so in that knowing, like, what would you say is probably one of the biggest barriers for newcomer family members or patients that are trying to get help now? Like what's one of the biggest barriers that if you could go back to yourself, 7 years ago, 8 years ago and say, hey, you should probably do this, like what would you do? What would you tell yourself?
Well, as I said, the biggest problem was not knowing where to turn, and you're thrown into this world that you never intended to be a member of, with a child that's desperately ill with addiction. And you don't even know what questions to ask. You don't know who to trust. And, we went through a lot of, we went through some bad places, like I remember when we were still in the wishful thinking stage, hoping that, oh, this was just a phase my daughter was going through. She came home for Christmas from college, and we decided to have her go see, I don't remember if it was a psychologist or a psychiatrist, but somebody who, was supposedly an expert and could advise us on, what we should do. And so my daughter met with him, and, basically he came back and he said, everybody drinks in college, nothing to worry about. Well, that was not quite true. She was drinking all day, and it just got worse and worse and worse. And, there were just, you're trying to do the right thing, and you don't even know what questions to ask. And so one of the other things I did in the early days with Conquer Addiction is I interviewed a bunch of other parents and created an ebook with what I wished I had known, 8 years later, where, I've obviously been reading a lot since and stuff like that. And it's 28 pages of, good information treatment about, here are some of the warning signs. Here's what it means to go into treatment. These are the different types of treatment. How do you find a good treatment? How do you help, how do you improve the chances that they can stay abstinent post-treatment or stay in recovery post-treatment? And so, I interviewed a lot of different parents, some of whose kids were doing well, some of whose kids were not. I think one of them kids had died. Another one, the child was living on the streets of, one of the big urban cities still. So, we just trying to bring a lot of information to the parents. But the biggest need that I saw was just for a trusted source of information about where are really effective treatment centers. So that's what I'm really excited that Conquer Addiction officially launched yesterday. So, it's just a start. There's still, I was realizing this the other day, it's still less than 1% of all addiction treatment centers in this country are measuring their post-treatment outcomes. I mean, that still is a shocking thing to me. But
real quick on that, what is the biggest hurdle for the ones that aren't? Like, what do you think that, because I hear all the time, and having gone through some of this before, collecting the data is difficult. The having standard metrics is very difficult. So like, what would you say for you is like, what's the challenge for them?
The problem is that this is a notoriously difficult group to reach. And, a lot of centers will decide they want to do it themselves. Oftentimes they will add it into the job of an alumni coordinator. Well, the job of an alumni coordinator is extremely different from the job of a researcher. You need, an alumni coordinator is really there to help improve the chances that a patient can stay in recovery. And what they do is absolutely critical. Sometimes I'll talk to a potential client and they'll say, we're going to start using Vista Research Group to do our outcomes, and we'll cut back on our alumni group. And I go, please don't do that. They're two very different things, and that alumni group and that touch and that how are you doing, Joe, that is so critical to have the patients feel like somebody cares. That somebody's in their corner, somebody who knows knows their story and, is really there to help. I mean, don't try and, get rid of the alumni so that you can do research. They're totally different. But it's also totally different in terms of, for a research to be effective, you need to promise the patients confidentiality. So they know that they can tell you that they're injecting heroin again, and it's not going to go back to their clinician, who would be devastated to hear that. Well, an alumni coordinator, his job is to help people get better. And so if they know somebody's struggling, they're not going to, ask more and more questions. They're going to say, Joe, how do we get together? And that's not what a researcher does. A researcher is collecting data. So, we do at the end of our surveys, if somebody admits that they're using, we will ask, would you like someone from your treatment center to contact you to possibly discuss going back into treatment? And if they say yes, we then will immediately reach out to the treatment center and let them know to contact this person, that this person is asking for their help. But, meanwhile, we've collected the data, we've finished getting all the information we need, and then we've said, and I've had, I frankly don't do many of these calls at all anymore. I mean, we've now got a team of, half a dozen researchers, but for whatever reason, I've done a few of these calls where I remember talking to one person who'd been out of treatment a month or so, and I said, are you using cocaine? And, and this is all, most of our surveys are done online. And, he's like, yeah. And I said, well, how recently? 10 minutes ago. and I mean, he was all in it for the gift card, right? He wanted that $10 or whatever, that was all. And I'm thinking, oh my gosh, this guy is, he's just partying. He doesn't care about anything. And then I got to the end of the survey and, would you like someone from such and such treatment to get in touch with you? And there was a long pause and he said, yeah, I really do. And I was just shocked because I had just said, that this was, in my mind, this was a kid who, was, yeah, I started within hours of leaving treatment and I'm having a good time. And I mean, I just didn't expect that he would say, yeah, you know what, this really isn't the road that I want to be on.
Yeah, it brings up an interesting point with this chronic disease, and that it would be very similar to, you talking to somebody that's really in the grips of a cancer patient, for example, and then they're in the grips of the pain and everything that is associated with cancer, and you offer them treatment at the end. Of course, they're going to say yes, and that's what we see in this. That we may present differently. When we're on substances or other things, but in the end, like, I think most people do want help. Most people in the grips of addiction are suffering from the disease, no matter what it looks like on the outside. So I think that's amazing. I do want to talk to you a little bit. You brought it up earlier about harm reduction, and it's something that I want to chat about. That for a long time, and especially for new families, you look at abstinence as the goal, right? And if that can only just get them to stop drinking or stop using, that's the goal. And what we see for those of us that have been involved in this and seeing that maybe, hopefully that a person can get to where they're not using substances or anything to address an internal condition or the disease. But when it comes to recovery capital or harm reduction or improved quality of life, like what are you seeing on your ends, and how are you guys tracking that? Because we know that a person that relapses, that's not necessarily a failure. If they have grown, if they've got tools that they're using and they succumb to a relapse, and then they get back on it again and they're starting to work through things, and they're still seeing an improved quality of life, that's not a failure. So how are you guys tracking those outcomes whenever it comes to harm reduction or people that are improving in their lives and maybe have a relapse?
Sure. Well, there's a lot of different points that you made in there that I totally agree with. This is a chronic disease, and relapse is unfortunately and scarily a part of the process for many people. And so what we consider success is at 6 months or a year, have you met your treatment goals in the last 30 days? So, maybe it's a year from treatment and they relapsed at 6 months, but they had the skill set, they had whatever it took, they were able to regain recovery. And we consider that a success. If they were in abstinence-based treatment, if they were not using any drugs or alcohol in the last 30 days, or if they were in harm reduction treatment and they were meeting their self-defined drug and alcohol goals. One of the things we've spent a lot of time over the last year is trying to determine how we can create a level playing field between abstinence-based treatment and harm reduction treatment. And, the problem is that, frankly, up to this point, almost every one of our programs of our clients is an abstinence-based program. We have really not found many MAT programs that are willing to invest in tracking their real post-treatment outcomes. There's been a ton of research that shows that while someone is taking their medication, that they have a lower risk of death, and that's absolutely true. But there's other research that shows that between 30 and 70% of people will drop out of medication-assisted treatment in the first month. So what happens to them? So and no one is following up with those people, and so what we've developed with Vista is a comparable program where we can cost effectively, follow up with a random selection of people, whether they remain in treatment or whether they leave treatment, and be able to see, okay, so this is what, 6 months or a year later, this is what is happening with your patients who have stayed in treatment. And here's what's happening to, your patients that have not stayed in treatment. And we don't just look at drug and alcohol use. I mean, we get all sorts of information about, are they back working or back in school? Are they getting along better with their families? Have they avoided any more run-ins with the criminal justice system? Are they using less? Maybe they are using, but they were binge drinking, 3 nights a week before, and now that's once a month. And we look at all that kind of thing. Or maybe they're back using something else, but it's not as it's maybe not as risky as, injecting heroin or something. So we look at all of those factors. We also look at, how many trips to the ER have they had, and how did that decrease between the pre-treatment year and the post-treatment year? And can the treatment centers use that savings? We actually will do a payer financial analysis where we've actually we've hired researchers to find the actual cost by region of the country for different ER visits and hospitalizations and stuff. And we can say, okay, your average patient had this many unplanned hospitalizations per year before treatment, and now it's dropped to this, and each one of those costs, X dollars in your area of the country. And so therefore you have saved your insurance company an average of, I don't know, 12,000, 15, 18,000 a year per member that they sent to your treatment center. So, we're trying to give, we're trying to make the outcomes, we're trying to present them in ways that our clients can really use that data when they're talking to payers and stuff. So that's what we're doing with Vista. But now with Conquer Addiction, we're trying to use those outcomes to attract more patients to the centers that have, proven that they have excellent outcomes.
Yeah, because there's just like you, whenever I got into this field, I was amazed at how many services were out there. There basically this whole world opened up. I would start going to events and see all the different providers all over the country, and it's amazing how many people are out there doing good work. But on the front side of it, how it was so hard to access that. Right. And so my own personal experience was walking into it, and then it just opened up, and I'm like, wow,
right.
There are options. And there's so many options out there to address the different people that come in, to address different types of addiction, different walks of life, different socioeconomic backgrounds. And it works really well. And so I'm real excited about the work that you guys are doing there. I'm excited about the renewed interest in outcomes studies, because we do need to be able to show parents and family members of loved ones that yes, there are options out there to fit the patient whenever they're coming in. So I'm really excited about it. Before we close today, is there anything else that you're working on that you'd like to tell people, or if there are companies out there that want to start tracking outcomes, like what should they look for, things like that?
Okay. Well, a couple of things. One is, I'll answer your last question first. One of the things, as I said, we've now, as Vista Research Group, we've been doing outcomes for, a growing base of clients. And one of the things we did last December was we published a 50-page report called Learnings from 3 Years of Addiction Treatment Outcomes Research. And because our focus for both Vista Research Group and for Conquer Addiction is to help the entire industry improve, we're providing this to anyone who might be interested. Just go to 2019outcomes.com. So 2019outcomes.com, put in your email address, and you can download this. And you can now see your own results. If you start measuring your own results, you can compare that to the norms of Vista Research Group clients. And we'll be updating this on a regular basis. So it was based on, I think, 23,000 patients during treatment and thousands of patients after treatment, and what we found from reaching out to them. And so, I'd strongly recommend any treatment centers that are doing their own outcomes or thinking about it, this would be a good place to start to see, here are some of the things you might track, and here are some of the things that you might look for. Another thing that you mentioned earlier was you were asking, why is it so difficult to do outcomes? And I started to answer and then probably got off on some other tangent. But, what we found is that it's relatively easy to hear from the top, 15, 20% of patients. And most companies that do their own outcomes, that's what they want to publish, their results of, we reached 20% of patients and 80% of them, reported that they weren't using. That's wonderful. That's wonderful. But you cannot extrapolate from that 20% and say, we have an 80% success rate. That's what a lot of treatment centers have been trying to do over the years. I remember a treatment center owner telling me he had a 98% success rate when I was looking for treatment. And I'm like, I may not know a lot about this industry, but I do know that that's nonsense. What exactly does that mean? They weren't using the moment they walked out the door? What exactly does that mean? And so one of the really goals for Conquer Addiction is establishing a real level playing field. And the fact of the matter is, if you're only reaching 20% of your patients, you can't assume that the other 80% will follow that same percentage. So what we do with Conquer Addiction is we look at what percentage are reachable and say that they're meeting their drug and alcohol goals. So, instead of an 80% abstinence rate there, we would be reporting 20% times 80% is 16% success rate. And that's probably not going to get anyone too excited. So, in order to get real, hard, good data, you really need to have a system that allows you to reach typically about 50% of the patients or more. And as I said, this is a notoriously difficult patient to reach. So, what we've done with Vista is we will make 10 to 15 attempts to contact the patient each time. We pay the patient something to take the surveys in terms of, instantly send them gift cards and things like that. And we also will reach out to locator people, a mom or a spouse that a patient has given us permission to contact in case their cell phone number changes. And so as a result of that, we typically are able to reach 50 or more percentage of patients each time. But we work awfully hard to do it. And we've spent 4 years systematizing this and automating it and learning from what doesn't work and stuff like that. It's just very, very difficult to do. Yeah. The other thing is that, if a treatment center does the outcomes themselves, they're always going to be taken with maybe just a grain of salt, because unfortunately there were a lot of people in this industry that were making up numbers and claiming that they had it. And so, I would just really encourage, I think it's so important to track outcomes. I would just really encourage people to really think about how to do it well. If you're going to make the effort, how do you do it well? And how do you make sure that you end up with results that, that are really, going to make the case that you want them to make.
Well,
So,
and you touched on it just a little bit earlier when talking about alumni and alumni programs and how it is two different things. But this is one area where a thriving, active alumni program really does help, because if a patient becomes an alumni and they're actively involved, well, then they're going to be much easier to reach, right? They're going to be much more active.
yeah, absolutely. Another thing I'll just mention, I mean, I'm so excited about the progress that the whole industry is making in, becoming, in measuring and improving their outcomes. One of the goals that I have for a long-term goal is, if we can get a lot of, a broad spectrum of addiction treatment centers to actually be doing, tracking their outcomes, whether they're doing, medication assisted treatment, whether they're doing abstinence-based treatment, if we can get that on a and standardize that and compare the results, I think that there's an opportunity, a couple of years from now to have data on a large enough base of patients that we could actually start to predict what type of treatment would be most effective for a particular patient based on maybe their demographic profile or their drug and alcohol use history or whatever. But, imagine and people will just say, oh, sure, when I say that, but imagine being able to predict to a mom who's bringing in her, a 22-year-old son and say, based on the fact that, he's been using opiates for, 3.5 years, abusing opiates for that long, we think he will be more likely to be alive and thriving a year from now if he goes on Suboxone today. Or, maybe we think he'll be more likely to be doing well, with some other type of treatment. But to have hard data to be able to base that decision on, I mean, that'll be just, an incredible game changer in the whole industry. And it sounds like such a pipe dream. And yet this is where the rest of healthcare has been for, a long time, or a lot of the rest of healthcare has been. And so that's what makes me so excited every day, to think about the potential of, what we're doing as an industry with outcomes measurement is just fabulous.
Absolutely. I couldn't agree more. Like I said, just the renewed interest in it and people getting excited about outcome studies and putting that down. I think it's great. I really think it's a testament to our industry. Our field is growing up and hopefully joining the rest of healthcare. I do think we have a number of meetings to have and parties to bring together. But I'm really hopeful that we can get there and hopefully this is a step in that direction, right? So, look, I really want to thank you for being on the show today. I'm going to put some contact information up here, and let's see. Yeah, so if you want to reach out to Joanna, you can email her here. You can give her a shout. There's her phone number. Go check out Conquer Addiction. We're really excited to see the work that Joanna and the team are doing there. It's definitely a service that is needed in this for family members and for those that are just new, that are looking for help. So I'm just really excited and glad to be able to do this. And is there anything else you'd like to say before we close, Joanna?
No, I'm just so excited to be invited to speak about what we're doing, and just really encourage anyone who is listening to figure out, how can you, what can you do to, if you're providing effective treatment, outcomes, measuring your outcomes and finding the right ways to share those outcomes will help you, attract more prospective patients, and also, attract hopefully higher reimbursement rates with the payers. So it's a win-win.
Right on. Well, thank you so much. I'm going to just take a second. I want to thank our sponsors once again, Southworth Associates and Dreamscape Marketing. I know we've talked an awful lot about monitoring and outcomes today, and I know that at Southworth Associates, we do interventions and also we do monitoring as well. And so we believe in it 100%. We know that it works. And then for all of your marketing needs, please visit Dreamscape Marketing, visit those guys over there. And I do want to say in closing today that Southworth and Dreamscape, we've partnered together to build a virtual events platform with everything that's going on with the COVID-19 outbreak and all of our networking events that normally Joanna and I would be hanging out at and doing things that we've had to bring it into this virtual space. And so we built a platform to put on educational conferences, events with a trade show floor, and it's a blast. So if you guys are interested in that, please reach out to us and we'll definitely go over a demo. On that note, next week for the show, we're going to be broadcasting from the Mental Health Marketing Conference. And so we're doing that virtually through our platform. We have a number of great speakers out there, so you can go register for that at mhmmarketing.org. And it's the Mental Health Marketing Conference. So go sign up for that. And we'd love to see you guys there, but we'll be broadcasting live from that event next week. And with that, we'll go ahead and sign off today. Joanna, once again, thank you guys, and we will see y'all next week.
Thank you, Glenn.
Thank you.